The Black Country ICB takes responsibility to maintain effective quality surveillance of all independent hospitals within our geographical boundaries and where Black Country people are placed further afield in longer-term specialist hospitals. There are 6 independent hospitals in the Black Country, with a further 2 due to open in June 2024, supporting people with a diagnosis of a mental health condition, a learning disability and/or autism. These hospitals are caring for people of the Black Country, but also for people placed by other integrated care boards. To do this role effectively, we have a small team who work with other ICBs, Black Country Healthcare NHS Foundation Trust, the local providers, the Care Quality Commission and those people and their families who are using the services, to gather intelligence and monitor the quality of care provided. In this video, we get an insight into this vital work and how it protects some of the most vulnerable who are residing in the Black Country.
So as quality reviewing officers, we visit hospitals both within the Black Country and further afield. At the heart of the process is the patient experience. We hope to offer a comfortable forum where patients can be open and honest and provide views about the care that they receive. These views, whether good or bad, form the basis of the feedback that we then provide to hospitals, and will then help shape the quality of the care moving forward, not just for the current inpatients, but for the patients in the future.
Georgina spoke about the patient experience. That's really important, but the other key factor of our quality assurance framework is focusing on patient outcomes. So when we talk about patient outcomes, we talk about the pathway and ensuring that the service is delivering on that pathway, and that the person is really understanding where they are on the pathway, where they are on their recovery journey. Recovery and instilling hope for people who in long-stay mental health hospitals is a real key factor of rehabilitation. So ensuring that the service is measuring that progress throughout the person's journey, and they're then feeding that back to the person, the carers, the relatives, and to us as a system is really important.
So following receiving action plans from hospitals, we can then provide consistent and regular assurance to the ICB and partners, including Black Country Healthcare Trust, through the panel process. We liaise with other ICBs to provide assurance and share intelligence regarding hospitals within the Black Country, but also to highlight concerns around hospitals outside of the Black Country footprint. For example, following a quality assurance visit to a hospital in Birmingham, we raised concerns and shared intelligence, which led to partnership working with BCHCFT to initially safeguard and ultimately improve services for patients.
When we first started in our roles, one of the key concepts that we felt was really important to do was to build relationships, both key relationships with all partners, but integral to that was the key relationships with hospitals, the independent hospitals, both within Black Country but on our wider quality assurance framework. But significantly with our host home hospitals within the Black Country footprint. So we established regular contacts, monthly meetings, quality assurance visits, but also that ad hoc contact of things may go wrong, they may have successes, they may have periods of time where things are more challenging, but it's having that opportunity to really have those open, transparent conversations that really builds that kind of no surprises culture.
We also spoke to Jodie Bauer, the hospital manager for Signet Raglan House in Smethwick. Raglan is a 25-bed high-support hospital rehabilitation service for women. As one of the 6 existing independent hospitals within the Black Country, the team are responsible for quality oversight of this service as the host ICB.
We receive quality assurance visits every 6 months from our host ICB. From those visits, there was areas identified that we needed improvements in regards to our physical health monitoring and the reviewing process. So from those visits, we've been able to recruit a registered general nurse who has helped support us with our reviewing processes in regard to physical health monitoring and reviewing of our patients. This has improved our patient experience and the overall quality of care in regards to their physical health in our mental health setting. So we have monthly regular catch-ups with our host ICB. They're more informal meetings. I feel comfortable to be able to share any issues that we have at the time or any good news and good practice that we are doing at Raglan. I feel that we have a good working relationship with the ICB and I can be open and transparent with anything that happens at Raglan.
The team have also worked in partnership with Joanne Veal, Deputy Chief Strategy Officer for the Black Country Healthcare NHS Foundation Trust, and her colleagues to provide a robust governance and quality-led approach to supporting the process for the review and funding of placements.
Since we became lead provider in July 2022, Black Country Healthcare NHS Foundation Trust have had the responsibility for the commissioning of specialist placements, those 100% health funded placements for the Black Country system. And as part of that responsibility, we have in place a health funding panel, 100% health funding panel. And that is a full multidisciplinary panel, and that works in partnership with our ICB colleagues, and ICB colleagues are on that panel. And the ICB colleagues that are on that panel are the individual placement quality reviewing officers, who are Rob Marson and Georgina Jackson. As part of that panel, we very much work in partnership around our placements. The panel is not only there just for approval of funding of placements, but is also there to review and scrutinise and to also escalate any issues that we have around placements. It's also there so that we have a quality assurance over both providers and of where our patients are. So within that panel, we will often have new placements that come through, but we will also have that responsibility to review and also that responsibility to scrutinise. And where that has been really, really helpful is where we have had providers who we feel may not be looking at the right outcomes for our patients and the outcomes that we need, and we're able to collectively, in partnership on that MDT panel, really look at how we question and challenge those providers and really get better outcomes for our patients. We've worked together really well, particularly with Rob and Georgina. They are very much part of the panel and almost part of our team. And that means that we quite often work together on other aspects that sit around the panel. So the things around the terms of reference, how we approach our providers, what those quality mechanisms are, what our standard operating procedures are, and also around how we move forward with regard to strategies and our plans that sit around those strategies that particularly need that focus around our placements.
As part of this quality assurance process, we requested feedback from partner organisations, including independent hospitals, Black Country Healthcare and the ICB, in the form of a survey. The feedback was largely favourable and demonstrates how the process is having a positive impact on patient outcomes. As an ICB, we are now confident that we have a robust assurance framework for independent sector hospitals providing care and treatment to some of the most vulnerable people within the Black Country.
We continue to strive to make a difference and to benchmark ourselves favourably against the new draft NHSE Mental Health Host and Home Integrated Care Board guidance. These new ICB arrangements provide a framework for host ICBs to have single oversight of and monitoring responsibilities for the quality of mental health hospital provision within their geography. The responsibilities apply to mental health inpatient care within the ICB footprint, irrespective of whether or not the host ICB has or intends to commission those services, or where operational oversight may be delegated. So this opportunity to reflect has also given us an opportunity to take real pride in what we've been able to build over the last couple of years. So we talk about those relationships, we talk about the frameworks, we talk about the outcomes, but significance of that is we've improved outcomes for people within these services, and quite often, probably significantly, these are the most vulnerable people in the most vulnerable settings.